Asthma, chronic rhinosinusitis with nasal polyps, and atopic dermatitis are three chronic conditions that often coexist in patients. They can cause a myriad of symptoms ranging from the mild to the severe. At best, they are irritating. At worst, they profoundly affect patients' quality of life. These three chronic conditions are linked by a common pathogenesis. It's called type 2 inflammation. What is it? Why is it relevant? What do we know about it? And how do we improve the lives of these patients? This is the EUFOREA Innovation Forum debate on improving coordination of care in type 2 inflammatory disease. Hello, I'm Dr. David Bull, and welcome to EUFOREA's debate on the improved coordination of care in type 2 inflammation. EUFOREA's first annual Global Chronic Rhinosinusitis with Nasal Polyps Awareness Day was held in 2022. It explored the wide-ranging unmet needs of patients and examined their suggestions for improvement of care for those with CRSwNP. EUFOREA set out to further explore the needs and suggestions of European patients with chronic type 2 inflammation of airways and skin. Interviews with 81 patients across Europe revealed that people living with type 2 inflammatory diseases often feel limited by unpredictable symptoms, and they feel isolated by their experiences living with a chronic disease, often more than one. From the persistent itch of atopic dermatitis to unpredictable asthma attacks to the loss of taste and smell attributed to CRSwNP. Patients living with type 2 inflammatory diseases not only experience a wide array of persistent and uncomfortable physical symptoms, but they also exhibit psychological symptoms too. Now, interestingly, patients across type 2 inflammatory diseases included in the publication who were interviewed agreed on many of their perceived shortcomings of care, including the lack of coordination among healthcare contacts. From delayed diagnosis, disagreements between physicians, healthcare inequalities, physician shortages, and lack of follow-up, amongst many other things, the patients had many suggestions for the healthcare community. Well, to tell us more about type 2 inflammation and to help me unravel the type 2 inflammatory debate, we've assembled a world-leading panel of experts and patient advocates from all parts of the globe. And I'm delighted to introduce them all to you now. First up, the chair of the International Patient Advisory Board of EUFOREA, Ms. Nelly Claes. Next up, the chair of the Patient Expert Centre, which is a Belgian non-profit organisation which aims to improve the quality of life for patients, Mr. Stefan Geisels. And now on to our medical experts. From Finland, Professor Sanna Salmi, leader of the Helsinki Airway Research Group at the University of Helsinki and senior consultant otorhinolaryngologist at the Skin and Allergy Hospital of Helsinki University. From Sweden, Professor Lars-Olaf Kardell, Professor and Head of Division at the Karolinska Institute in Stockholm. And last, but by no means least, from Australia, Professor Pete Smith, leading allergist at Queensland Allergy Services and Professor of Clinical Medicine at Griffith University and Bond University, Southport in Queensland. Now, we're going to divide our debate into three sections. The first section will be about understanding type 2 inflammation. What is it? What diseases are characterized by it? And how do these diseases manifest in patients? The second section will address the current shortcomings of care highlighted by patients and experts. And the third section will look at ambitions to improve interdisciplinary collaboration and what the next steps in this journey should be. So chronic rhinosinusitis with nasal polyps, or CRSwNP, asthma and atopic dermatitis are chronic inflammatory diseases of the upper airways, lower airways and the skin respectively. The majority of these patients share a common pathogenesis. It's called type 2 inflammation. Different T helper 2 and ILC2, that's type 2 innate lymphoid cell cytokines, drive the chronicity of inflammation in the different organs. So what is the prevalence of these diseases? Well, globally, the prevalence of type 2 inflammatory diseases is increasing, with CRSwNP prevalence around 3%, asthma around 1 to 18%, and atopic dermatitis standing about 10% of the population. So perhaps I could start with you, Professor Salmi. Perhaps you could start by just explaining what type 2 inflammation is, and do you think I did it justice, that introduction?
Oh, yes, sure. These are very, very difficult diseases. They share, in part, common pathogenesis. So usually there is upregulation of certain interleukins, such as interleukin 4, 5 and 13, and there is too much eosinophilic inflammatory cells in the either in the airway mucosa or gastrointestinal tract mucosa or skin, and this causes the typical symptoms, the difficult chronic inflammation and very severe, sometimes very severe problems for the patient.
Yes, it seems so indeed. The fact is that obviously all these diseases seem to coexist. Professor Smith, perhaps I can come to you next. Just talk us through which diseases are characterised by type 2 inflammatory diseases. Now, clearly I mentioned asthma, I mentioned CRSwNP, I also mentioned atopic dermatitis. What else can we put into that in terms of type 2 inflammatory disease?
I think top of the body, we could start allergic conjunctivitis, allergic rhinitis, eosinophilic esophagitis. We even have aspects of different food sensitive enteropathies involving type 2 responses. I would like to sort of stress that it's an evolution of terminology that really enforces with type 2 disease. It's an orchestra of inflammatory responses. We used to think of allergy as being IgE, and it's bigger than that. And then we went to Th1, Th2 disease, which talked about CD4 lymphocytes. We know, as you've mentioned, we have innate lymphoid cells. We have, as has been mentioned, eosinophils. We do have IgE-producing cells being involved, but it's a mixture, MR cells are involved. So it's a mixture of cells that contribute to that disease, and we need to better understand how they work together if we are going to better treat these diseases.
I absolutely love that, the orchestra of diseases. Thank you very much indeed. And of course, we're evolving in our understanding of these diseases. I want to bring in Nellie Claes now. You, as a patient, clearly identify with many of these things that the experts have outlined. Tell us your story, your symptoms, and how you presented.
Okay, I was almost 40 years old when I was diagnosed with CRSwNP and comorbid asthma. I have also an immunity problem. It takes more than 1 year before I was diagnosed, so I went through hell. And when doctors finally know what the problem was, it becomes better. And since then, I take a lot of medication every day. And even when I take the medication, I have a lot of headache, earache. I can't smell or taste anything, and I'm very tired. Usually 2 or 4 times a year, I have an upper airway infection, and then it's necessary to take corticosteroids and antibiotics. And when this medication stops working as it should, surgery is required. And all this affects my financial possibilities, my social life, and it has always an effect on my emotional life.
I'm sure it sounds very debilitating indeed. Perhaps I can bring in Professor Cardell now. So we've heard really from Nellie Claes there about the fact that this really changes her life. She has all of these symptoms. Even on medication, she is still affected by these diseases. Could you just talk us through the symptoms of these conditions, the types of symptoms that patients might get?
Yeah, we can try to sort of make it one by one. And of course, it's dominated by the individual symptoms of a three major diseases that you have mentioned several times. So if you start with chronic rhinosinusitis with nasal polyposis, you have the anosmia, the nasal congestion, the mucopurulent drainage, as mentioned, headache or facial pressure. And then the loss of smell also goes together with loss of taste and sometimes also impaired hearing, that altogether creates a sort of disconnection from the environment.
So these symptoms clearly are life-changing, actually, aren't they, Professor Cardell? They really impact patients' lives.
Yeah, sort of. That's you say it's a small disease of a nose, but it's actually creating a stray patient isolated, in the worst cases, from the rest of the world, or with severe problems to communicate and to participate in social activities. And that's just the nose, yeah.
I mean, it's really interesting, actually. Thank you all very much for the moment about that. I think people now, our viewers, will understand that actually this type 2 inflammatory disease needs to be taken very seriously. And clearly what we're seeing is a lot of comorbid diseases and the impact, which can be very severe on patients' lives. So thank you very much indeed to all of you for that.